Hi, welcome back. Thanks for joining me at the Medicare Show. I'm your host and Medicare advisor, Jeffrey Kuhn. In this episode, I'm going to discuss a little bit about veterans benefits, specifically people that use the VA, not necessarily TRICARE. So you want to differentiate this a little bit. But there's a lot of people out there that do and are entitled to VA benefits that don't get TRICARE for life as a military retiree. But what I want to share with you is some things that I've had discussions with, and I've been asked to speak to a group of veterans at an American Legion coming up in a month or so because they've realized this is a really important subject and not a lot of vets know about it. So I thought, it's very timely in this because I've been dealing with this for years. And it makes me think about it because my dad recently was asked to participate on an honor flight. So we're going to be doing that this summer. And I'll share what that trip is like. There's going to be some surprises he's not aware of. But that trip is going to be down to Washington, D.C., and he's been looking forward to it. And, he talks about some of the people that he was in boot camp with before they were shipped off to, he didn't actually go, but his friends ended up going to Vietnam. My dad got spared and put in a medical unit. He's a chiropractor, and there was some general or something or colonel ended up treating that had no idea and said, wait a second, we can't send you over, but, we're going to change what you're doing. And some of those guys and his friends that went over didn't come back, alive. And they're down there on the wall of the Vietnam Memorial. And, he talks about these friends of his that he had and how much he's looking forward to this trip. And I go, I've had a lot of veterans, and there's a gentleman that asked me to speak that's part of the American Legion. And I thought, it's probably good to do something on this because there's a lot of veterans out there use the VA. And I think the VA's come a long way for a lot of people. You hear people complain about it, but overall, there's a new VA medical facility up here that, my father goes to. I know a lot of people that go to, and they've had great feedback. They get free glasses, prescriptions. And over the years, I've run into vets that use the VA. And as we all age, and I can, speak firsthand, you start needing a little bit more than your standard annual physical. Sometimes stuff comes up, right, as we get older. And the VA is great for a lot of people. And a lot of people at some point decide, I want to go see a specialist outside the VA, and I need to get better doctors involved than what I have access to here. And they're recommended to go see whether it's cardiologists, certain procedures, and they realize the VA is not necessarily end-all be-all for their health care. And the VA, if you have VA benefits, is considered credible coverage by Medicare. So I want to get that out on the table first, right? You get your prescriptions there, and I've got vets that have been only covered under the VA, and they've been on Medicare A and B, and they decide at some point they want to go on Medicare. There is no penalty. They've had credible coverage, so you can transition over. You can still use the VA for your prescriptions. In most cases, that's honestly one of the best places, especially the expensive drugs. It's a great place to get them. But it gives you better options on the medical side of things. I say more options, not necessarily better options, but it definitely gives you more options. And there are plans out there specifically designed for veterans that do not have prescription drug coverage. They're able to offer more robust benefits in those plans. And you just need to know that you need to get your prescriptions from the VA. Still, the VA's credible coverage, but a lot of people aren't aware of these plans. And they've just used the VA coverage. There's no cost in most of them. They're free. They're great benefits. And these are things you want to take a look at and take advantage of because you do get some additional benefits with them. I'm not going to get into it. Medicare is a little tricky with that stuff. But if you've got questions or want to know what's available in the area, you can just pick up the phone and call me. The number is going to be below, or I'll pop that up, have my guy pop that up on the screen for you so you can see it. But it's something you should be familiar with in your area. Is it available? We did have one with one carrier that they pulled out completely, so I had to change carriers with those veterans plans. And they're typically called Patriot plans, Freedom plans, something that's patriotic, the name of those. And they're great benefits. I mean, they do offer some fantastic, robust benefits. They've got great networks outside the VA you can use. And you typically can switch over to those at any point in time because in most cases you've had credible coverage. So, assuming you've got open enrollment periods, you're in your annual election periods, some state-specific FEMAs that you might be qualified under. Those plans might be available to you. You should take a look at them. I mean, they are good for veterans, and I want to make sure the veterans out there get the benefits that you really deserve outside of just what the VA has, because you do get some extra things with those. And the coverage is really, really good. Again, you can still use the VA, but be aware there's other plans out there. My dad, perfect example. The hardest thing was to get him to say, okay, Dad, he's used to going to his favorite pharmacy, getting his prescriptions filled. And I had one of his friends, great guy, use the VA, take him down there, show him the ropes on the prescriptions, and it's easy. They just send him to him. Doesn't mean you can't go get your prescriptions filled elsewhere. A lot of these drugs, I'll tell you, this year in particular, and I've told my clients, and this is going to be another upcoming podcast about how you should manage your drugs in 2026. Medicare has a $2,100 out-of-pocket max for your prescriptions that are covered under your drug plan. A lot of these prescriptions are really cheap. Your tier ones, a lot of the tier twos, you can just go and get these if you ask the pharmacist. What if I pay cash? Can I use GoodRx? A lot of times it's a lot cheaper than your copays. My dad had a really inexpensive prescription he needed. Didn't want to necessarily go to the VA. And he called me and asked, and I told him, I go, here's about what it's going to cost at the pharmacy. Just go pick it up. It's going to be $5, right? It's not worth the stress and aggravation having to go to the VA. So you always have that option. And people think, well, if I have insurance, I have to use it. I had another client that came in. This was yesterday, as a matter of fact, albuterol. They're paying a $50 copay for it. Not Adverb, just a regular inhaler albuterol. This has been one of the number one prescriptions I've told people. Don't assume your insurance is cheaper. Depending on what your pharmacy is, ask, if I pay cash, what's that going to cost? I mean, that prescription before you could get for $20 without using your insurance. And I looked at what's available at different pharmacies around cash price, you looking at GoodRx, $30, $34 without using your insurance versus $50 using the insurance. I mean, what would you rather pay? Now, there's reasons that you want to use your insurance. If you're on other expensive prescriptions, you're going to max your out-of-pocket costs. That's $2,100. But you want to be a little more educated. So for the vets that are out there, they're using the VA, keep using it. They're always typically cheaper there. But you do have the option. You can still go to a regular pharmacy and not have insurance if it's a cheap prescription. Call whoever you use for your Medicare plans. You should be using somebody. Don't just rely on the insurance company. Get somebody good that you can pick up the phone that's local, that knows the plans of the ins and outs and knows the pharmacies. It's really important these days with all the changes that you've got somebody that you trust that can help you with this. So for all the vets out there, thank you so much for your service. And if there's anything I can do to help you with this, by all means, reach out and call me. We answer the phone or we will call you back. And I want to give you free advice around questions you have around your plan, what options are there, and it's the least I can do for all the service that you provided to all of us here and our country. Thanks again. Bye-bye.